Yep, so my name is John Galpin. I'm the Managing Director for In Friendship Home Care and Support Services. We're a home care company based in Witney, Oxfordshire, set up in 2020 with myself and my wife to provide a home care service, hopefully with a difference, to our clients based in and around Witney.
So tell me how big the company is.
So there's a total of 21 employees, including myself and my wife. We have a client base of around 65 clients, and we provide approximately 2,000 support hours a month.
Okay, so we're talking to you because you're a big advocate of GP Connect. Just tell us briefly about your journey so far with GP Connect.
Yeah, really good. I think we got head starts where we completed our data security protection toolkit for the NHS about 2 years ago. There's obviously quite a bit of work involved to go through that process, but the process that we followed 2 years ago was relatively straightforward. The toolkit that is online gives you a good platform to work through. There's lots of resources, templates, guides to help you through it. And then having that in place enabled us to start the journey with CareLineLive and the GP Connect service. The GP Connect portion of and setup was really straightforward as a result. So the paperwork involved to get that in place, the consent form template was relatively easy. Through adopting really the what is now available in the market is through AI. So really adopted that platform to help us get us through a lot of the paperwork and enable us to start using GP Connect. Experience GP Connect, huge game saver, huge time saver. I'd say it's cut down probably about 2 days worth of care management time to chase clients for updates on the medication, chasing GP surgeries, chasing pharmacies, asking carers to go in and take screenshots of people's medical requirements, medication requirements. So now we literally, with consent from the client received, we can connect in and have a live view on the client's current medication. So yeah, brilliant. Cannot fault it.
Great, that's really good to know. So what you're doing with us today is you're going to show us DSPT from a provider's perspective. We know that this is one of the things that puts providers off getting on with GP Connect because they think it's going to take them absolutely ages. So I've not seen this process. So if you can share your screen and just walk us through the kind of back end of it and what providers can expect.
Sure, no problem. So let me share my screen. Let me know you can see the screen.
Yep, that's good.
Okay, great. So this is the Data Security and Protection Toolkit login page. Once an account has been set up, you can simply log in and it takes you straight through to your assessment. Now, our assessment is due. We did a repeat assessment or our annual assessment back in July this year, but it was reset, I think back in September, October for us to do again. So we've got between September, October and next year to do our assessment for the 25-26 assessment year. In here, I mean, it's really straightforward. It's all updated on a regular basis. You can see it's currently on version 8. And it gives you a progress bar on the number of mandatory evidence items that you have to go through and provide as part of the assessment. And the assessment is split into different categories. You've got staffing and roles, you've got policies and procedures, you've got data security, IT systems and devices. And then I think that's it from memory. Yeah, so that's it. And then within each section, it's marked whether it is a mandatory requirement or an optional. So optional being blank. So if I look at this first one, It's talking about our organisation's approach to security, how it's owned and directed by senior responsible individuals, with regular discussions driven by individuals. So I know that's mandatory, it's marked as mandatory, and that's marked as completed. When you do an assessment or repeat assessment, the completed fields actually then disappear and you have to go back in. But the beauty of this is that when you do go back into each of these sections, it saves your previous responses. So if I pick this first one here under staffing and roles, so I clicked on there, and then it repeats the question along the top. It then gives you a blurb around what the requirement is, and it gives you a guide and a pointer to give you a better understanding. So anyone that would look at this would immediately or may bulk and go, oh goodness, I'm lost already. This is a lot of gobbledygook. I don't really fully understand. But within each section, there are links that actually take you to the digital security hub. And then that gives you a breakdown of what the responsibilities are. And there's also some great resources in here. So a guide around how to document your data processing, and also things like templates for information asset register. So I managed to download this template and complete this separately with ease. The good thing about this whole kind of exercise is it kind of gets you to think outside of your day-to-day care, and also it gets you to start to focus on your tech setup and think about each of the providers that you're using to deliver your care. So I was able to, for example, go on the CareLineLive website, have a look at all of the data security and privacy information, which is readily available without needing to contact the providers directly. So a lot of the information that you can gather is available online through different vendor websites.
Yeah, I mean, those things are a lot of work for us to have achieved ourselves. So they're obviously going to be something that we will be singing about on our website. So yeah, you're right. It'll be on vendor websites.
Yeah, absolutely. So quite a straightforward answer is providing details and contact information by hitting save.
So really, all you're doing there is you are just putting the relevant individual's name and email address in. You're not actually having to provide any further evidence of what they have done in the background there.
Correct.
Although obviously going through that information is important. Nice.
Yeah, no, absolutely. So for that, the answer to that is just that's quite a straightforward one, but making sure that there is an ownership of data security within your organisation, and providing the contact information is enough to mark that particular item as evidence and being completed. So I mean, the next one, so you've got, does your organisation have an induction process that covers data security and protection, cybersecurity? The answer is yes. We, as part of our induction, all staff are expected to complete an e-learning platform course. So we put all of our staff through, for example, cybersecurity essentials, and also handling information for GDPR and data protection. And those two items are actually recommended as part of the mandatory training that you provide to staff, as advised by Skills for Care. So again, that's something that was quite straightforward to put people through. So but you'll really also notice on here. Yeah, go ahead. Sorry.
Whilst doing DSPT is a bit of a pain, a lot of what it's doing is getting you to do things that you ought to be doing already by way of, one, good practice, and two, in many cases, legal requirements, because you know, data protection is a legal requirement. We are handling really, really very sensitive client data.
Absolutely. And one thing I do love about this toolkit, and I've worked in different sectors and different organisations where cybersecurity and data protection is obviously mandatory for every organisation, but there isn't anything that I've used that provides a good platform and guidance on how to navigate that part of your organisation. So having this that is focused on care is actually a huge help. So I was really impressed with the process. Yes, it took me a couple of days, say 2, maybe 3 days to go through this, and I went into it. I answered some sections, come away and come back in, because it can be quite heavy and quite labour intensive to go and find the information. But as you say, Mary, going through the process forced us to analyse actually what we have done and what we haven't done. And I found different areas of our organisation that we hadn't considered. So, for example, business continuity plan. We had a rough template on about 2 pages, but it was a really loose document. It wasn't really a document that we could use in practice, but using the template that's been provided through this toolkit, we were able to build out a good solid business continuity plan. So if we do lose connection or power, for example, in our office, we have a plan in place and what we enact in that event. If our internet goes down in our office, then we can enact a process to continue our service to our clients. So it's, from that perspective, absolutely, it's been really, really worthwhile.
Good.
You'll also notice on here, which is good, again, another link. So the Digital Care have a really good website and full of resources, but they do have a free e-learning training course if you don't have anything already in place. So you can go onto there and complete the e-learning for staff and also for the leads within your organisation. We do have a e-learning platform that we use that covers both cyber essentials and data security. So it's good. But there's also this website if you're struggling or don't have an e-learning platform in place already. And
great that that's available free of charge for providers.
Yeah, absolutely. So if you go ahead and hit save, gets marked as completed. Next one, all employment contracts and volunteer agreements contain data security requirements. So you can see this isn't completed. I have completed this twice previously. So I'm going to go ahead and open this. And I put a comment in there to say, this is a previous comment to say included as a clause in all staff employment contracts. And then all I simply do is I give that a tick and I can mark that as completed. So when I went through that process, so we've got 2 or 3 different blends of employment contracts. We've got for employees, we've got casual workers, bank staff. So it forced me into looking at those contracts and making sure that it included a section on data security. I actually found through that process, the first round of doing this, I had it in 2 contract types, but I didn't have it in the 3rd. So I managed to obviously update our template contract and also get those employees or staff on the old contracts to re-sign their agreement. So it included excerpts of digital data security.
So that's protecting you as a business as much as anything else, isn't it? So
absolutely.
Super important.
So I'm going to go ahead and hit save, and you can see now that's marked as completed. So from a kind of an admin perspective, some of these questions are quite quick. Some you might have the answer to, some you're forced to go and take action on, and that's great, and it protects you, as you say. And then answering actually within the toolkit itself is pretty short. If the work is actually what you do outside of it. So yeah.
But as you said, you can go in and out of this. It saves what your work is to date. You can go back and change things if you're not happy with what you've written already. So it's really just a case of making some time, and you can chunk it over a number of days to go through and just get it done.
Absolutely. So I won't go into all of these questions. There's a few in here. But for example, it's asking what our organisation's ICO registration number is. So every year we're registered. I'll give you a good example with this question. We actually changed offices last year. So in July, when I did the reassessment, I went onto the ICO to check our registration number and found actually it had our old address. So it triggered me into contacting ICO and getting our registration updated with our new office address.
This is the registration you pay, what, about £50 a year, and it's because you're handling data and you just need to be registered with them as a handler of data, yeah?
You've got it, yes. I think it's about £45 a year. correct me on that one. Yeah, but yeah, it's a mandatory requirement to be registered with the ICO.
And that's the case for any organisation in the UK, whether it's voluntary, charity, private sector, any business that is handling data should be registered with the ICO.
Absolutely. Going down here, you've got, does your organisation have a privacy notice? So one of the requirements for GP Connect was to ensure that your privacy notice talks about GP Connect and how that data is handled. So not through this toolkit, but when I did the GP Connect setup, I actually went and updated our privacy notice that's on our website, and also our privacy statement that's within our policy handbook. So we've got a booklet that contains all of our company policies, and I've evaluated both website and within our booklet. How I updated it? Yeah, go for it.
I know a lot of providers will say, "Oh, can we need an example of that? What can we use?" Did you use AI like ChatGPT to help you create that?
100%, yeah. So I actually fed into AI our current privacy notice. And I provided AI with a number of links from the CareLineLive website, and also the information that's readily available online around GP Connect as a service. And I asked AI to review my current privacy notice and provide suggested updates based on its learnings from the websites that I provided. And then it came back and gave me a revised version of our privacy notice. One thing I will say, though, and anyone that's new to AI, is do read what AI gives you, not just for typos. Typos, not so much. It's more,
It's
in terms of language,
isn't it? As much as
Americanisms. Yeah, absolutely. And sometimes the way in which it structures the feedback and the changes isn't quite right. So sometimes you just need to reorder it. But my suggestion is to talk to the AI platform that you use and say, please change it from Americanized to UK English. Please order the sections so it's more in a logical order. And then you can continue through different versions coming back through your AI platform until you get the privacy notice or whatever document it is that you're creating to give you the output that you need.
Yeah, I mean,
don't just rely on what it tells you first time around.
And that's one of the questions that we often get when we talk about GP Connect. It's like the consent form. Well, have you got an example of a consent form? And again, AI is a great tool to get you moving on that, so you get an idea of what you can put in, and then you can tailor it for yourself.
Yeah, absolutely. So again, using AI as an example for our consent forms, our process was we would, for all new clients, we would provide them with a support agreement, the contract, and then once they sign the contract, we would then send them an onboarding email, and within that onboarding email, we would have a separated consent forms. So they would literally open up 4 different consent forms, read through, sign off, and then they would come back to us individually. So they would obviously have choice. We changed that, and with AI, we put our current support agreement into AI, we put our current consent forms in there, and then we also asked it to point at different websites and produce consent for GP Connect. And we asked AI to create one single document, so all of our consent forms now reside in our customer contracts. So the only document upfront that all new clients have to read through and sign is our support agreement, which contains all of our consent forms. So one document, all helped being created using AI.
Great. Now, you don't tend to use ChatGPT for this. You use a different platform, don't you?
I do, yeah. There's a platform called Claude, so CLAUDE. Claude is, I would say, more data rich. It goes out to ChatGPT is very similar, but Claude, I would say, is more broad-minded. It looks out to multiple different websites. It pulls on different resources. The interaction with Claude is a bit more interactive. So you could actually say to Claude, this is what I want to achieve. Ask me the questions that you need for me to achieve that. And then Claude will then push back a set of questions for you to answer. And at the end of that, it will then go away and create the document or whatever task it is you're asking it to do. So yeah, it's a fantastic tool.
Good. So are there any other questions here that you feel would be worth kind of digging into for people?
So if I scan down, so privacy notice was good. So a quick scan down. So does your organisation have up-to-date policies in place for data protection and data cybersecurity? This was great. I went straight into this one. It's things like data protection, data quality, record keeping, data security. We had some of these, not all of them. We didn't have data quality and record keeping. So again, going into the digital hub. And then within here, you've got a subset of templates that you can use. So they've got privacy notice template, data protection policy, data quality, record keeping, data security. Again, talk about AI quite a lot, but we did, or I did, asked it to do a comparison between these templates and what I already had. And then it then gave me back suggested updates, which I then pulled into our policy booklet. So
really
some really good stuff.
Saves so much time, doesn't it?
Tons, yeah, absolutely. So yeah, that's one. So yeah, just cannot really stress enough how important the links are within each of these questions and how you can navigate out to find the templates and the information you need. It's a good learning exercise. It's a very dry subject, and as I mentioned, do a bit. Do 10%, go away, come back, and then chip away at it until you get it completed. But definitely don't try and attempt this in one go.
And then you're just having to review it and update it annually.
Correct. And then once you've completed it, you can see previous publications. So my first one I did on the 9th of July 2024, and I did earlier this year on the 3rd of July 2025.
So I guess what you're doing as you go through the year is that you're going in, and as you're updating things and changing things, you're adding in to this as you go.
Yeah, absolutely.
Oh, and here's your certificates.
And there's my certificate. And this is the certificate that I had to use as part of my GP Connect application setup, going through that process. So I called on this certificate because it asks you for from memory, it asks you for your certification ID.
Which is what you've just highlighted there.
Yeah, you got it.
Fantastic. Well, John, I think that's been really, really useful for people. It's no longer this scary thing. Well, it's probably still quite scary, but this scary unknown thing. And actually, when you click through, some of it is really quite straightforward, and there's so many things to help guide you and to enable you to answer these questions. So it is doable. Oh yeah, 100%, 100%.
Yeah, right. Don't be afraid, and don't put it off. There's a term I was taught a few years ago. It's not the nicest of sayings, but it's called "eat the frog." And they say at the start of every day you should eat the frog. It's a task. No one wants to eat a frog, right? But if you get the worst task done at the start of your day, the rest of your day is going to be plain sailing. So maybe start your day, do an hour, go into the Data Security and Protection Toolkit, do provide a few evidence items back, come away, go back in, but chip away at it, and in no time you'll have it completed.
Yeah, and your reward for it is that you can then start using GP Connect, which is going to save you days and days and days every year. I mean, you're saying you're saving 2 days a week on, which is just immense, isn't it? And think about how much money you're paying someone to sit on the phone to GPs and to pharmacies and to photograph things, and just the ease that you'll get with GP Connect in comparison to the current process. So that's the reward.
Yeah, absolutely. And it's not even just the medication. It's finding out about the last 3 encounters with the GP. It's having a glimpse into medical history. So when we're going out and doing care reviews or our initial care assessment, we can then review GP Connect based on our notes, and then we can then bring the information from GP Connect into our assessment. And equally, when we then do our quarterly care reviews of our clients, part of our process, one of the steps that our team follow is they then go to GP Connect. Have there been any changes to medication? Have there been any recent GP interactions? is there anything that we may have missed on the initial assessment, and then we can pull that together and then present that back to the client. So yeah, really, really good.
It's a fantastic tool, and I don't think I've spoken to anyone that's using it that has regretted doing it. I mean, we're not really here to talk about GP Connect, are we? But DSPT is the necessary evil, if you like, in order to get to it. So look, thank you so much for your time today. I'm sure many providers will be very, very grateful for this. And I should also mention, you're about to do a webinar for us on GP Connect. So if people are watching this on YouTube later on, I will also put a link in the notes on YouTube to that webinar, so you can see the demo and the discussion in more depth of GP Connect. Thanks very much, John.
No problem at all. Thanks, Marie.
Cool. All right, let's